I'm Bill McLeod. I'm an instructor of martial arts.
Grandmaster.
Yeah. And for I've been doing martial arts since 1963. The type of martial arts I do is jiu-jitsu, which is a very aggressive contact art as well. So it puts a lot of trauma on your body. I was diagnosed as having spinal stenosis. I went to, in the beginning, I went to a chiropractor, and temporarily the pain that I was getting, because it was difficult for me to walk, it was almost not difficult, for a while I couldn't walk at all without the assistance of another person. I went to a chiropractor, I went to acupuncture, I went to pain management center, everything to try to get back to normality in terms of my regular routine. None of the things that I was doing was working. So the doctors, I went to the hospital for special surgery, which is a kind of renowned hospital for people who have the type of debility that I was having. uh, NYU Spinal Center, Methodist Hospital, and each one of these places that I went had suggested, and I had four different opinions, and all of the opinions said that to correct the conditions that was plaguing me, I would have to do surgery. So one of my students, who's an actor, pretty renowned actor, he seen the condition that I was in, and he told me that he would be able to help me. So at this particular time, he was going to South America, and when he told me when he came back, I'm sorry, South Africa. When he came back, he was going to put me in touch with somebody that would be able to help me. And at this point, being that I had tried everything else, it was a welcome type of opportunity that was presenting itself. Yeah, when I went to NYU Spinal Center, I had to go with the assistance of my son and one of my students to help me, because walking was extremely difficult. When I left out, my student called me and he told me that he was going to connect me with this person that would be able to help me. And this person inquired about whether it was my lower or my upper lumbar. And I told him it was my lower lumbar, so he said he would be able to help me. Now, this particular person was in Los Angeles at the time, and I was here in New York, and I live in Brooklyn. And this particular day, I was leaving NYU Spinal Center, which is located in Lower Manhattan. And by the time that I left the Spinal Center and got home, I was feeling some type of relief from the pain that I was receiving, and I was moving a little better. So I didn't know how to process this. I was kind of like in denial about what could possibly happen. I thought maybe it could be because of the painkillers I was taking, or some of the other modalities that I was experiencing. So after a day or so, I spoke to my student and I told him that I was feeling something, but I didn't know exactly what it was, and there was some relief in the pain. So he told me after this particular individual would touch me, I would be almost 100% better. So on my behalf, he flew this individual in from Los Angeles, and I stayed with him for 5 days, and he worked on me. I don't know how to describe the type of processes that he was using in the treatment. I don't know if you want to call it massage or Reiki, or it was some type of energy healing that went on. And he told me at this particular time that what he was doing was he was my spine was crushed, and he was relieving the pressure off of my spine, and that I wouldn't need surgery because the treatment that he was giving me, the disc on his own would go back. So after these 5 days of treatment with him, I started walking better. And after the fifth day, he gave me kind of a standing meditation exercises to do on a regular basis, along with some stretches. And since then, increasingly, I've gotten better and stronger, and I'm able to teach my classes myself again.
What did the surgeons say when you went back?
When I went to the doctors who had sent me to these different places for to take my MRI, to see these specialists, these surgeons. And when I went back to see the doctors, when they first seen me, they said, "Oh, you took the treatment. I see that you're moving better." And I told them that I hadn't taken any treatment, that I was using kind of an alternative type of thing, and their mouth fell open. It was unbelievable. They couldn't believe that the condition that I was in when they last seen me and the condition that I came back in, and I was like perpendicular, walking without a cane.
Wow. That's awesome. And the person has continued to do some distance treatments with you as well, right?
Yes. What's magical about this whole process is this guy, he lives in Los Angeles, and I'm in Brooklyn. And he kind of sees my body from where he's at. I don't know how he's able to do this, but he can see the displacement of the spine, and he moves it. Not only do he do this type of healing, but he also do the type of healing if there's an infection, that he kills the infection long distance, as a matter of fact. It's amazing.
It's amazing. Thank you for sharing, Grandmaster.